Hi, I'm Dr. Mukesh Gupta from Lenest Malad. Today we're going to discuss the top 5 things that need to know when you deal with accidents in pregnancy. So, what are these 5 things that we need to know? Number one, why is it a pregnant woman is so susceptible to accidents? Two, what are the various type of accidents or injuries that a woman is susceptible to or common amongst pregnant women? Three, what are the various precautions that you can take so that you don't land up with this situation and you don't land up with accidents and injuries? Four, what are the various problems that the woman or the child faces if they are exposed to an accident or they are subjected to a situation like this? Last but not the least, how a pregnant woman or an individual who is accompanying a pregnant woman should do what they should do to better help a woman who's landed with pregnancy and accident. So let's start with first thing. That during pregnancy, very often we see that woman lands up with various different types of accidents. Accidents like, slipping in the bathroom and they're trying to walk and they just trip and they fall down. And while crossing the road or something, they sometimes lose their balance. If they're climbing on something, they may have higher chances of falling down. They can also, like any other person, be a part of a major accident like car accident or road traffic accident and similar such things. The most important reason why we are more susceptible for various different accidents is that our body is not the same that it used to be when you were not pregnant. So why is it that this is happening? First of all, the tummy is coming out. It is just shifting the center of gravity, and the whole body, which was balanced and poised, suddenly because of the increasing weight, there is a shift of gravity and they are not able to balance well. Add to that the hormones. The hormones actually, things like relaxing hormones, they relaxes the ligament and the joints, which also affects to some extent. Sometimes there is edema or swelling. So, for example, the carpal tunnel syndrome and other such things which you land up with during the pregnancy makes it difficult to have a firm grip on the railing or anything for support. So that also leads to chances when you are not able to balance yourself, you're not able to hold yourself back easily. Last but not the least is your joint position senses. They are also challenged during the pregnancy. So all these various factors adding to the situation of your pregnancy where when you're trying to walk and put your next step and your nice big tummy and the baby is coming in between where you're not even able to see your feet where you're putting them. And remember, these are the not simple feet. Many times they are so swollen and heavy that you just find it difficult to pick up and put them. All these factors make you more susceptible for accidents. Sometimes you just don't realize. I have had patients walking in and saying, Doctor, I was just trying to sit on the chair and I couldn't realize what was the height of the chair and I fell down. Sometimes they say that, Doc, I don't know what happened. I was just climbing down those 2 or 3 steps at the gate of my building and I just tripped. Sometimes they find it difficult to get into the car and coming out of the car. And I'm not even going and telling you that how common it is for them to trip in the house with things falling here and there in the floor. And they just trip and they don't realize and land up with an accident. So these are the various different reasons why a woman land up with accidents in pregnancy. A, the anatomical changes. B, the hormonal changes. C, the swelling and various different things which impacts their joint position senses and their balancing. Next important thing that comes on the mind, the third important thing is that if these accidents are so common, what are the various set of precautions that a woman should be taking during the pregnancy? So number one is accept the change in their body. If you're able to accept the change in your body, life is much more easier and you're much more careful. Don't walk fast. Walk at a pace which is acceptable to your body. Watch where you're going. Do not pick up things which you do not want them to fall. For example, do not try to work on your, chinaware or your crystals because you know that your grip is not as good as it used to be. Let somebody else do that job for the time being. When you're having a bath in the bathroom, use a stool, sit down and have your shower or have your bath. The reason is there are three balancing things in our body. One is your vision, second is your middle ear, and third is your joint position senses. Now, during the course of pregnancy, when you're having a shower, you're keeping your eyes closed and the soap, etc. Add to that your altered joint position senses. So it becomes difficult for you to balance Sleeping in the bathroom is one of the most common accidents that we come across during our practice. So, easiest solution, take a stool and sit down. It's not necessary for you to stand and have your bath. Don't allow your partner or yourself to have clutter on the floor. So, the tendency of your partner coming in, leaving his laptop bag or his shoes or socks or stuff on the floor, or your elder child who's spilling the toys all over the house, all these things need to be collected and gathered and so that it doesn't come in the way. Especially in the night when you have to keep rushing to the bathroom in a very semi, sedated state. You're very tired and you're very fatigued and you find it difficult to walk, and at that time something comes in the way, you find it difficult to balance. I remember one pregnant woman during the course of pregnancy, she slipped entering the bathroom and she hit the wall and she had a fracture on the face. It was extremely traumatic. There's another thing that we are worried about during pregnancy is fatigability. You're extremely tired. You're extremely, not in the mood of doing anything, and that is the time when your balance is also altered. So see to it that you have support system. See to it that you ask for help if you find it difficult. And last but not the least is accept the change in your body. So this was the third important thing. Fourth important thing is what are the various injuries that can happen. Now, one of the things that we need to know during the pregnancy is that although the baby is protected in an amniotic bag and an amniotic fluid and the uterus as such, but depending on which stage of pregnancy you are, for example, if you are in the first half of pregnancy, the uterus is quite down. And in the second half of the pregnancy, as you move ahead towards the later part of the month, the uterus is almost covering the whole abdomen. So it all depends at what stage you're getting the injury. So the commonest injury that can happen during the course of pregnancy is A, injury to the various internal organs of the mother, B, injury to the uterus leading to bleeding and abruption and similar such things, and C, distress to the baby. But remember, the most common reason for the baby to be distressed is because of the bleeding and injury to the mother rather than injury directly to the baby. So baby doesn't get injured, but it is your injury or the bleeding which can lead to problem to the baby. Sometimes the blunt trauma to the abdomen is so common that it can impact and lead to abruption of the placenta or separation of the placenta and the bleeding. You are also susceptible to various different internal injuries like the splenic injury or the intestinal injury or the bladder injury, like any other woman who lands up with an accident. What should be done when you have an accident? That's the fifth point that we wanted to discuss. Whether it is you or your partner or any layperson who is seeing a pregnant woman who landed with an accident. One of the golden tips is that do not forget that it is not just the patient but also the baby who's going through this problem. So they should be immediately taken to the healthcare centers. It can be a minor trauma, it can be a major trauma. Minor trauma like a laceration or a bruise or whatever, but it is extremely satisfying if you have any form of injury or a fall to go to the hospital and get yourself checked with your specialist and see whether the baby's heart rate is fine and everything is good or not. Because sometimes there are some blunt trauma of the abdomen which may not be evident initially, but they start showing its impact a little later, like concealed abruptions. Another very important thing is that when the patient is really having a major trauma, we need to quickly act to prevent excessive bleeding more than any other situation, because the bleeding is going to not only impact one life but it is going to impact two lives. When the patient is being shifted, you have to give a tilt, a left lateral tilt, because the heavy uterus coming on the great vessels is going to impact the blood return to the heart. So the common tip is that keep the patient a little tilted on a left lateral side with a wedge or a pillow or a roll of bandage or a towel or something on the right side. And if you're not finding anything, you can just manually move the uterus on one side when you're shifting the patient to the higher center. So these are the small tips that you can take care at the time the woman lands with an accident. One last golden tip: wear your seat belts when you're traveling, because wrong way of wearing your seatbelt is one of the commonest causes for injury. How do you wear your seatbelt during pregnancy? Remember, there are two belts here. So the vertical one goes in between the breast and on the side of the abdomen and goes down. And the horizontal one, which is lower down, goes below the belly. Below the belly. It should not be over the belly, which may not be a great idea. It should be below the belly. These are the two tips which are very important. Remember, it should be snug and not very loose. And the reason is that if you put it on the belly and there's sudden impact, it is more harmful than if you put it on the waist. It's a simple logical thing to do. But remember, wearing of seatbelt saves more than two-thirds of the women as compared to not wearing of the seat belts can impact more than half of the women and lead to problem with the woman, to the patient. This is a scientific study which has been proven. So last but not the least, accidents in pregnancy are very common. Whether it is accidental slippage, whether it is accidental burns, whether it is accidental injury or any such things. But the smart thing to do is to understand your body, relax, use meditation as an important tool to calm your mind and not be agitated or anxious. Anyway, your hormones are playing game there. Lastly, if in doubt, if there is any accidental injury or any doubt, please go to the specialist and get yourself checked, and they will decide whether you require further set of investigation or not. Thank you. Be safe.